Digging in deeper to Alzheimer's disease. So, an outline of this presentation is introduction, symptoms and diagnosis, treatments and clinical trials, cost and care, conclusion, and citations. Alright, so going into symptoms and diagnosis, there are a multitude amount of symptoms that Alzheimer's patients can experience. These also can overlap over different diseases and disorders. An example of main symptoms would be the cognitive disturbances such as depression, irritability, mood liability, anxiety, and sleep disturbances, motor disturbances, dementia, cognitive dysfunctions that can cause hypercholesterolemia, hypertension, diabetes, obesity, and cardiovascular diseases. These symptoms considerably diminish the life quality of patients and increase the mortality risks. Alright, so the diagnosis process, you will be in the doctor's office, so you'll be having an office-based clinical assessment. You'll be given a functional activities questionnaire, receive a revised memory and behavior checklist, and then you'll go over your family Alzheimer's history, dealing with the apolipoprotein E4 allele on the chromosome 19. Usually you are diagnosed at a late irreversible stage and given a survival period of 2 to 8 years. Moving on to treatments. There's no cure. There are different medications which their primary goal currently are to boost the patient's functioning and quality of life. So examples of these treatments are metamine, which is an MDMA receptor agonist, Namazarak, Donepezil, and these other ones here. They're acetylcholinesterase inhibitors, so they're going to stop the production of cholinesterase, which will help the cognitive and neural function. And they may also use the SSRIs or mood stabilizers such as trazodone and Ritalin. Okay, so going into clinical trials, currently there's multiple different studies being studied about Alzheimer's disease. So two I specifically looked at are the anti-amyloid drugs. It's a set of 3 drugs, the lecanemab, the anandamide, and the donanemab. And these drugs help keep the amyloid levels low, as it shows this helps prolong cognitive benefits. So it'll help keep your brain strong and hopefully reduce the onset of Alzheimer's. These also have been seen to have primary adverse effects, which can lead to vascular inflammation, weakening of vessels in the brain, and can present edema or hemorrhage or both. So there are some negative effects to these 3 drugs. Alright, moving on to gene therapy. Gene therapy within Alzheimer's targets the A-beta pathway and the 2 pathway. These are responsible for the accumulation of amyloid plaques and neurofibrillary tangles, which are an effect of Alzheimer's or is said to cause Alzheimer's. This method involves delivery of transgenes that can alter the proteins involved in pathogenesis or the protection against Alzheimer's. The objective of gene therapy in Alzheimer's is modify the disease process by enhancing the neuroprotection, reducing the pathological proteins, and modulating the function. You can kind of see a way they do this gene therapy within Alzheimer's here. Moving on, so cost and care. So within one of the articles I read, Leon did a study basically estimating the monthly expenses between mild, moderate, and severe cases of Alzheimer's. And we can see it's about $1,000 difference between each 3 of these. The total annual cost in the US is $51.3 billion. This is the informal and formal care for Alzheimer's. If we are calculating in the resource loss and the caregiver's lost productivity, this total would be at $100 billion within the United States. I also read that delaying onset Alzheimer's disease by 5 years would reduce this prevalence of cost by $4.07 million, and delaying by 6 to a year would still be beneficial, as it would reduce by $10 billion within 10 years. So basically, we would see this reduction in the prevalence cost because we're seeing less long-term care. We are also seeing a reduction in the prevalence cost with the treatment drugs, as they're reducing your cost by $10,000 between diagnosis and death. Moving on. So, in conclusion, Alzheimer's is a very aggressive, costly, and deadly disease that affects a large portion of the population. Finding a treatment to delay or reduce the onset of Alzheimer's would be very beneficial for patients, but also the public health, as this would save billions of dollars. All right, thank you for taking the time to learn about Alzheimer's